Million doses. Our friends in Israel, Teva, have handed over what? It's going to be 10 million by the time it's all said and done for free. Bayer, same thing. Manny is the orthopedic trauma surgeon in Nashville, founder of Healthy Tennessee, Republican U.S. Senate candidate. I want to get into specifically this issue of a possible disruption of the pharmaceutical supplies. This is something you're really good at. First, tell us what's going on. I do hear that Tennessee is becoming a little bit more of a hot spot like Georgia and Florida and maybe Detroit and Chicago. But what's going on there? But more importantly, what about our reliance on pharmaceutical chains coming from a place like China?
Well, Sean, hey, thank you so much for having me, and thank you for what you've done for this country and for the conservative movement. I am a trauma surgeon here in Nashville. And yes, we're seeing rises in cases. We got about 2,500 in Tennessee. 13 people have passed away. So we are seeing sort of that exponential rise. And but I believe with the Lord's help, we're going to get through this together. And I know we will make it through. But you are exactly right. Listen, the bottom line is that this is a matter of national security. Vital drugs and supplies, they got to be made in America. We just cannot allow the Chinese to have a chokehold over our pharmaceutical drugs or any of our supply chains. I mean, 90% of our drugs, our surgical gowns, our masks. I mean, these things are being made in China, and that's why we're seeing what we're seeing right now. And if we learn anything from what we're seeing, it's that we got to bring all of this back stateside. Years ago, Newt Gingrich, he tried to suggest that we need to give some of these companies tax advantages, tax breaks to get them to come back to America. But that's what we have to do, and we have to do it now.
What percentage of our pharmaceuticals come from China alone if 80% we rely on foreign countries for it?
I'd say, so there are about 20 drugs, Sean, that cannot be made here, that the vital components of them, like, for example, Tylenol, are made in China. And so this is a real problem, And here's what I think. I think America needs to hear a version of kind of what I tell my trauma patients the morning after surgery. And that's, when we look back on this moment, it could be a moment when we stood up, we fought forward, and we found our purpose. This is America. And when it comes to medicine, we can do this. America has the knowledge and the resources to win this fight. But as to how we got here, we know the answer. And, China did this to us. And we can never allow this to happen again. And what that means is we need an industrial revolution in America, but this time it's got to be around healthcare. We got to make the ventilators. We got to make the gowns. We got to make the masks.
I'm going to get into that in a second, especially in New York. China actually sold Spain $467 million in supplies, and according to a FoxNews.com report, many of them were substandard. That's pretty obnoxious. I mean, wow.
You're exactly right, and that's what's happening around the world right now. It happened in England. They opened a box, and about 70% of these masks are not working. And just think about it: you're a doctor, you're a nurse, you're a healthcare provider, you're wearing these N95 masks, and they don't even work. And that's why, if I'm your next U.S. senator here in Tennessee, that's what we're talking about. And I'd love for you to check us out. Go to drmannyforsenate.com.
All right, Dr. Manny, thank you, and keep up the good work. And our thoughts and prayers still with the people. All those people lost their lives from those tornadoes. Unbelievable, sad.